Hello, thanks for joining me today for this virtual look at Live Well Middle School Health. I'm Holly Whitaker, K-12 Sales Director for Human Kinetics. We are so excited to bring you this new, skills-based and remote learning-friendly middle school health program. We think you'll find that it strikes the perfect balance between content coverage and skills-based learning, while also giving you the flexibility you need to reach all of your students, whether they be in person or remote. Our hope is that Live Well Middle School Health will help students develop a passion for learning about health and will empower a lifetime of healthy choices. Our agenda for today includes an overview of the program, an introduction to the authorship team, a deep dive into the remote learning tools available to both students and teachers, and finally, a quick look at the student textbook. Live Well Middle School Health was strongly influenced by the author's experiences as health and physical education teachers, along with their years of helping to shape health and physical education curriculum and assessment. In writing the program content, they considered the most recent developments in health knowledge and research, while building in relevant skill development activities, reflection questions, and special features. The result is a comprehensive middle school health program with an intentional focus on a skills-based approach to learning. So without further ado, let me introduce you to our award-winning authorship team. Karen McConnell is a professor at Pacific Lutheran University and a certified health education specialist. Dr. McConnell has taught at the university level for more than 23 years in the areas of health and fitness education, curriculum and assessment, and exercise science. Terry Farrar is an associate professor and director of the kinesiology program at Pacific Lutheran University. Dr. Farrar has taught health and fitness education at the middle and high school levels for over 27 years and has taught health and fitness methods courses for over 10 years. Charles Corbin is a professor emeritus in the School of Nutrition and Health Promotion at Arizona State University. He co-authored 2 health series for grades K through 8 and is a senior author of several award-winning elementary, middle school, high school, and college texts. Dr. Corbin is internationally recognized as an expert in physical activity, health and wellness promotion, and youth physical activity. And in addition to our authorship team, Live Well Middle School Health was influenced by our HK Editorial Review Board. That's a group of nearly 20 practicing middle school health teachers, administrators, and learning specialists from across the country who reviewed the program. Now, one of the first questions that folks typically ask us when they're looking for a new middle school health program is, what does your program cover? Well, let's answer that question right now. Live Well Middle School Health is a comprehensive, skills-based program that is tightly aligned with the National Health Education Standards. The selection of topics in the book reflects the content recommended by the Centers for Disease Control and Prevention with the Health Education Curriculum Analysis tool. We also paid close attention to state-level health education standards in order to ensure that the program meets the diverse needs of students, schools, and communities across the country. So let's take a look at the contents in brief. As you can see, Live Well Middle School Health is arranged into 5 units that expand into 14 chapters. The 14 chapters include 3 to 5 individual lessons per chapter, depending on the depth and the breadth of the chapter content. Live Well content was arranged with flexibility in mind. So we know that you may not meet with your health ed students every day over the course of a year or a semester or even a quarter. The program can be easily adapted to meet your scheduling needs, and the authors offer helpful suggestions for how to organize Live Well by content or skill. And we'll take a look at some of those helpful tips a little bit later. So now that you had a chance to look at how the program is organized, let's talk a little bit more in depth about how Live Well works well in a remote learning situation. So when we built Live Well Middle School Health, we knew we needed a delivery method that would allow students to truly interact with the program, specifically the text. So enter HK Propel. HK Propel is the platform where Live Well resides. And it's a platform by which students and teachers can access all of their program resources online. It is LMS compatible. So for those schools and districts out there who are using an LMS and want to be able to allow Propel to talk with their LMS, that can definitely happen. Through this tool, teachers can assign content, students can read and interact with the content, and the learning can be assessed via online tools and through the electronic submission of worksheets and even tests. So we're going to take a look into the remote learning tools by first focusing on the student experience. Let's take a tour of the Live Well.
Human Kinetics Live Well Middle School Health Program includes an interactive web text, which students can access from a computer, tablet, or mobile device. The interactive web text reimagines the content from the print book. Each chapter begins with a short, animated introduction. And a self-assessment questionnaire to help students understand their current level of health. Whenever there is a worksheet to complete, students can simply click and download. Worksheets can be printed or completed and submitted electronically. Each lesson opener contains a wealth of useful information. Terms to Learn is where students can review all terms presented in the lesson. Each term and definition is available in English and Spanish with audio narration. Terms are interactive throughout this text. Click to see the definition or hear the audio pronunciations. The big picture and learning targets give a snapshot of the outcomes of each lesson. Each lesson features SEL connections that are identified by this icon. Finally, each lesson includes a journaling prompt and a downloadable note-taking guide. Students can read through each lesson, interacting with vocabulary, clicking to expand illustrations and photos, and exploring the healthy living tips. The headings in the left navigation bar allow students to jump quickly to any part of the lesson or chapter at any time. Each chapter focuses on a particular health skill and includes a skill-building challenge with a downloadable worksheet. For example, Lesson 9.1 skill focus is healthy communication. In addition to the main skill focus, each lesson contains activity prompts to build other skills such as analyzing influences, accessing information, practicing healthy behaviors, and promoting good health. Each lesson concludes with a summary, a review quiz, and critical thinking and take-home activities. The lesson review quiz allows students to practice what they've learned. Right-wrong feedback helps students know which sections they need to spend more time studying. The chapter concludes with several important elements. The action plan prompts students to set goals to apply what they've learned in the chapter. Students can review the examples and then download the worksheet to create their own plan. The chapter review quiz helps students check their understanding of key concepts. Additional gradable tests with questions of varying complexity are available in HK Propel and in ExamView. Finally, each chapter ends with a project-based learning assignment, which students can complete individually or in groups. These projects present opportunities for students to apply the skills and concepts they've learned. You can assign each interactive chapter via HK Propel, which allows you to track each student's progress and see at a glance whether the chapter is not started, in progress, or completed. To purchase Live Well Middle School Health, or to learn more about the program, contact your HK sales rep.
All right. I hope in that quick overview of the Live Well interactive web text, I hope you noticed a few key features. First, the interactive web text is truly interactive. We know that a student's level of engagement is directly related to their level of actual learning. Therefore, the interactive web text engages in students in such a way that they have to interact with the content. We didn't want just another PDF version of a textbook because middle schoolers need more than that. The IWT content is appropriately chunked, the navigation is intuitive, and the students can get immediate feedback to check for understanding. All right, so now let's take a look at Propel itself. All right, we spent some time talking about the student view rather, and the interactive web text. Let's talk a little bit now about the teacher view and the resources that teachers have available to them. The Live Well Middle School Health Teacher's Guide is organized in a similar fashion to the student guide. I'm going to take you out here and show you my bundle of teacher resources. Now you'll see that I have several different titles here that I have access to, but we're going to focus just on the Live Well Middle School Health Teacher's Guide. And we come to the introductory page. The introductory content over here in the left menu bar is going to give you the background content you need in order to be able to teach the program effectively. There are 3 subsections underneath the welcome section. One is the instructor resources, gives you an overview of what you're going to find there. The next is assessing student learning. In other words, how can I best use the assessment tools within the program to glean the most helpful information about what my students are actually understanding. And then finally, which I alluded to earlier in our chat, tips for how to organize and structure your class, not just from a content standpoint, but also from an organizational standpoint in terms of minutes of instruction and things like that. So let's take just a real quick overview of the instructor resources and spend a little time there. Each lesson has a complete set of lesson materials. They include lesson plans, worksheets, PowerPoint presentations, tests, and quizzes. Within a lesson plan, you're going to find common features and common tools. There'll always be an overview. There'll always be learning targets, tips for preparation before the students come in the door or log on, a warm-up activity to engage the students in the lesson. And typically there are multiple options there. Some lend themselves towards in face-to-face instruction, others lend themselves towards a remote learning situation. The lesson content, this is sort of that functional health knowledge you need to remember in order to effectively teach the lesson. Of course, the lesson focus, a challenge activity, which gives you a differentiation option, reflection and summary so that you can check for understanding, and then finally, assessment options. In addition to those features and elements, you're also going to have additional supporting materials such as self-assessment worksheets or self-assessment activities if the student is online that come in the chapter opener, vocabulary review worksheets, note-taking guides, lesson quizzes and chapter tests, skill building challenge worksheets, PowerPoint slides, answer keys, and then of course unit level resources such as unit quizzes, as well as rubrics that can help you take a more anecdotal assessment approach. So with that, you have an overview of what's included in the instructor resources and what you can find in the typical lesson plan. But we want to dig a little deeper. So let's take a look at a specific chapter and the resources available there. I'm going to bring you back over here to the left menu bar again. And below these general resources, you're going to see 3 chapters of content, chapters 1, 6, and 9. These are just a sampling of chapters from the book. And we're going to take a look at the instructor resources that go along with chapter 9. So let's do that now. So the chapter 9 lesson planner lays out all of the lessons that are included within a given chapter. So if you take a look here, you'll see that we have 4 lessons in chapter 9. And across the top on the black bar, you'll see the name of the lesson plan, the learning targets for that lesson, the National Health Education Standards addressed in that lesson, the instructor and student resources, and then finally the differentiated instruction options. Anytime you see this purplish font, you'll know that the resource in that purple font links out to the actual document. Or in the case of the standards, it links to a description of the standard. And that's true of all the lessons in each of the chapters. So you have all of your lesson resources literally right here in nearly a single screenshot. And you can just click on those and go to those as needed. Great flexibility if you're in a remote learning situation, working maybe from home or working from your classroom with students, without students, or some sort of a hybrid approach. So that gives you an idea of how the lesson planner is set up. Let me show you one of the things that links out here. And there you can see the note-taking guide. This is an editable document. Can handle it in a number of different ways. You could do it as a whole class activity. You could assign it to students. Students can print it off. They have access to these resources as well within their student portal. Oops. All right, so back to chapter 9, lesson planner. I want you to just take a look at the lesson plan now. This is a lesson plan for lesson 9.1. You'll see that if you scroll down, you can go through all of the different elements in order, or if you want to jump ahead and say, take a look at assessment right away, you can do that too. Really easy navigation, not a lot of back and forth, and really everything that you need sort of right there at your fingertips. But those lesson plan elements that we discussed a few minutes ago, you can see as I scroll down here, those are showing up. Again, you see that purple font, which lets you know that you can link out to those resources right from the lesson plan. You can kind of see those are pretty comprehensive lesson plans there. One other thing I wanted to bring to your attention in case you missed it, showed up a little bit earlier here in the lesson plan, and that's the PowerPoint slides. Along with all the things that you would expect us to have created for you as far as lesson plans, quizzes, tests, worksheets, we've also created PowerPoint presentations for you. So you're able to edit those as you wish or use them as is. But that teaching tool, a teaching tool that's really helpful in a remote learning situation as well, is already done for you. So I just wanted to bring that one to your attention. So that, in a nutshell, is the view of the teacher resource, the teacher's guide. Bring you back out here to the Propel dashboard. Again, my teacher resources are right here. My student content is loading right here. Now, keep in mind, if you're a teacher, this will be your view. You will be able to see not only the learning content, but also teacher resources. Obviously, as a student, they will not be able to see or have access to the teacher resources. As the short video that you saw alluded to, you can assign content. So if you wanted, in this case, chapters 1, 6, and 9 have been pushed out to me. And that content has been assigned to me. And as a teacher, I could check to see what sort of progress has been made on that. So just a little overview for you of Live Well Middle School Health and the remote learning resources in particular that are available with it. A couple of other things to keep in mind. I want to make sure that I make this very clear. In addition to all of the online remote learning resources you've seen so far, Live Well Middle School Health does offer a traditional hardcover textbook. So there's still obviously that option. And the hardcover books, along with the remote learning tools, can be used interchangeably and in conjunction with one another. In addition, there's a separate softcover supplemental chapter that covers the program's reproductive health and reproductive and sexual health content. That's available in print, as I said, in a softcover version, but also via the HK Propel online. And then there is the option to purchase a print version of all the teacher resources that we just briefly took a look at online. Important to know that the content in the hardcover text and in the interactive web text is exactly the same. So students who approach the content through the IWT and students who have the textbook are reading the exact same content. They're simply seeing it arranged a bit differently. The result is a program that provides the resources you need, whether your students are in person, remote, or in a hybrid model. So with that, I'd like to say thank you for joining me today for an overview of Live Well Middle School Health in a remote learning environment. Again, my name is Holly Whitaker. My email is on your screen. Please feel free to reach out to me if you have any questions regarding the program, if you'd like to see a sample, or if you'd just like us to give you another brief tour of how HK Propel and Live Well Health operate. Thanks so much. Have a great day.